Good afternoon. Thank you for joining us. So the BC's chief coroner is updating the province on the number of deaths from illicit drugs last year. It is the most in a single year. We're going to take you to that press conference with Lisa Lapointe. And for the open line, as British Columbians struggle with high costs, have you had to take on a second job? Let us know if you're working multiple jobs, why, and what impact is that having on you? That's our open line after 12:30. I'm Michelle Eliot. Welcome to BC Today. BC has recorded more than 2,500 suspected unregulated drug deaths in 2023. That is the most in a single year. The chief coroner started speaking a few minutes ago, and we're going to bring that to you. We're running it on a slight delay to bring you her remarks in full. Here now from Victoria is Lisa Lapointe.
Share information about deaths in 2023 due to drug toxicity. I gratefully acknowledge that we are on the traditional, unceded, and ancestral territories of the Lekwungen-speaking people, now known as the Songhees and Esquimalt First Nations. Before I begin, I want to send my heartfelt condolences to everyone in our province who has lost a loved one to drug toxicity, whether in 2023 or in the years preceding. Your child, brother, sister, mom, dad, friend, or colleague did not deserve to die this way. Their death was preventable. Their loss, your loss, is our collective loss. Close to 14,000 people have died as a result of drug toxicity in BC since this public health emergency was declared in April of 2016. And they've left holes in our lives, our families, and our communities. They are loved and they are missed. British Columbia lost 2,511 lives to drug toxicity in 2023, continuing the tragic death trend we've experienced over the past 10 years. The majority of deaths occurred amongst those aged 30 to 59, and males account for about 3/4 of those who have died. Deaths occurred across the province in communities both large and small, urban and suburban, rural and remote. The widespread nature of this crisis is demonstrated by the diversity of local health areas with the highest rates of death. The highest rate of death was Vancouver Centre North, the location of the downtown east side. The next highest rates of death in the province happened in Hope, Alberni-Clayquat, Terrace, and Greater Campbell River. No part of our province is exempt from this crisis. 80% of the deaths occurred indoors and in private and other residences, and 19% occurred outdoors, including in vehicles. Smoking was the most common form of consumption amongst those who died, with 65% showing evidence of smoking. Only 14% of deaths showed evidence of injection. The numbers of deaths of those under 18 remain, fortunately, comparatively low in comparison with all other age groups. Nonetheless, in 2023, 27 children and youth died of drug toxicity, just over 1% of deaths province-wide. There is no indication that prescribed safer supply is contributing to unregulated drug deaths. In 2023, hydromorphone was detected in 3% of expedited toxicology tests. British Columbia's drug toxicity public health emergency, declared in April 2016, is a direct result of the arrival of illicit fentanyl to the province's unregulated drug market. Since that time, illicitly manufactured fentanyl has continued to be the main driver of our province's toxic drug crisis. Since April 2016, 13,794 people in our province have died. There have been more than 40,000 deaths from opioid toxicity across the country in that period. In British Columbia, drug toxicity is now, and has been for many months, the leading cause of death amongst those aged 10 to 59. From 2017 through 2023, illicit fentanyl was present in 86% of drug toxicity deaths in BC annually. This is consistent with reporting across the country, where data for the first 6 months of 2023 shows that 84% of accidental apparent opioid toxicity deaths involved fentanyl. illicit stimulants are also regularly detected in postmortem testing for presumed drug fatalities. Last year, cocaine was present in just over 38% of drug toxicity deaths in BC. Amphetamines or methamphetamines were present in almost 47% of deaths. And increasingly, we're seeing benzodiazepines in toxic drug fatalities. Benzodiazepines were present in 40% of drug toxicity-related deaths in BC in 2023. All of these substances were obtained from the illicit drug market. Estimates from experts in this field are that 225,000 people in BC are using unregulated drugs. Of these, about 100,000 people have an opioid use disorder. Given the unpredictability of unregulated drugs, each of these 225,000 individuals is at risk of death. For decades, those using or dependent on substances governed by Canada's Controlled Drugs and Substances Act have been criminalized for the non-prescribed use of the substances the Act covers. Our country has historically responded to drug use with punishment, imprisonment, fines, court orders, and criminal records. This response has resulted in lost jobs, lost families, lost dignity, and lost hope. It has required huge investments in the criminal justice system, police, courts, probation officers, and prisons. One presumes that the reason we have a Controlled Drugs and Substances Act is to preserve and support the health and dignity of Canadians, our brothers and sisters, our sons and daughters, our parents, our friends, our colleagues. Yet somehow, along the way, it seems that any positive motivation for this legislation has been lost. Instead, we see many focus on stigmatizing, vilifying, and marginalizing our community members who use drugs, beating them down instead of helping them up. In focusing on punishment, we've neglected many of the things that would actually make a positive difference, that would actually reduce harms for individuals and communities, and that would actually save lives. What if, instead of continuing to revert to policing and punishing in the guise of public safety, we focused instead on addressing the underlying reasons people use substances or become dependent on substances: pain, trauma, physical or mental health challenges? What if we focused on developing a meaningful continuum of care for those experiencing harms from controlled and illegal drugs? Or developed evidence-based standards for evidence-based treatment and recovery? What about tracking outcomes of programs purporting to provide substance use treatment, often for huge profits? What if, instead of watching people die by the thousands in our province and across our country as a result of an unregulated, poisonous, illicit drug market, we provided those at risk of serious harms with safer, regulated alternatives? What if we stopped and asked those experiencing harms from substance use or at risk from dying from substance use how we could help them, or what would make a positive difference in their lives? When we lose sight of our goal of supporting the health, wellness, and dignity of our community members, we fall back to restricting, directing, and punishing. We forget to lift up, and we react by pushing down. If we truly care about our family members, our friends, and our community members, let's offer them support. Let's offer compassion. Why would we want to cause further harms to those who are already suffering? On January 31st, 2023, with the approval of the federal government, BC embarked on a 3-year decriminalization pilot. Under this pilot, adults in BC are permitted to possess small amounts of certain controlled drugs for personal use. The federal exemption did not permit this possession everywhere. It remains illegal to possess prohibited drugs on school properties and childcare facilities, in airports and other points of entry, or within reach of a person operating a motor vehicle or watercraft. The stated goal of this pilot is to recognize that substance use is a public health issue, not a criminal one. It acknowledges that shame and fear of criminalization can drive people to use drugs alone, and that using alone can be fatal. The goal of decriminalization is to help reduce stigma and encourage people who use drugs to seek life-saving services and care. It is to reduce harms. This idea is not radical. Decriminalization was recommended by BC's Provincial Health Officer in 2019. Decriminalization was supported by the Canadian Association of Chiefs of Police Special Purpose Committee on the Decriminalization of Illicit Drugs in 2020. Decriminalization was supported by the Health Canada Expert Task Force on Substance Use in 2021, and decriminalization was supported by a BC Coroner Service Death Review Panel in 2022. The goal of decriminalization is not to encourage people to use substances that may cause them harm. Rather, it acknowledges that people are using substances and seeks to reduce harm. History has clearly demonstrated that punishment has not been an effective response to a health issue. A response focused on enforcement and punishment has cost billions of dollars and has resulted in greater harms, including increasing the risk of dying. There are those who are concerned that BC's one-year-old decriminalization pilot has led to greater public drug use. We can find no data about public drug use. We don't know if more people are using drugs in public, or where, or who those people might be, or why. There's a great deal of data, though, showing that homelessness has increased drastically across our province. The Greater Vancouver homeless count showed a 32% increase in people experiencing homelessness in 2023 compared to 2020. Counts across the rest of the province showed similar results, with Fort St. John showing a 34% increase in people experiencing homelessness, Port Alberni with a 30% increase in people living unhoused, Vernon with an increase of 25% for those unsheltered, and Campbell River with a 70% increase in people identified as experiencing homelessness. When people are unhoused, they are often visible. They're pitching tents or trying to devise shelters in common spaces. They're resting on benches or in doorways. They're trying to stay warm or stay dry or stay safe, all in the public eye. We may see them using drugs outdoors because the outdoors is their living space. If public drug use is greater, is it due to decriminalization, or is it due to more people having nowhere to live? Decriminalization didn't cause inflation. Decriminalization didn't cause the housing crisis. Similarly, there's no evidence to suggest that the general public is at risk from public drug use. We know that those at high risk of death are those using drugs, particularly those who use alone. It's not comfortable seeing people use drugs in public, but who is most uncomfortable? Is it those of us who get to return to our warm homes and beds and showers at the end of the day? Or is it those living unhoused who are trying to cope the best way they know how, often while experiencing illness, pain, or chronic health conditions? Who is most at risk from a safety perspective? In the 9th year of a drug toxicity public health emergency, in which close to 14,000 people in British Columbia have died, we know that using drugs alone puts people at significant risk of dying. Again and again, my agency and multiple public health officials, including government ministers, have encouraged people to use in the company of others, and even better, in the company of those with access to naloxone and a first aid response. Knowing that, shouldn't our response to concerns about public drug use be the establishment of safe places to use drugs? Shouldn't we avoid pushing people who use drugs into alleys and dark corners? We can take measures to save lives, or we can continue to count the dead. I also want to address the issue of safer supply. In 2021, the province released policy direction for safer supply, allowing individuals to access a range of medications through prescription to reduce the risk of drug toxicity death from the province's illicit drug market. The goal of this initiative is to reduce the risk for those at risk of serious harms and death. In March 22, the Coroner Service Death Review Panel into the deaths of 6,007 people due to drug toxicity between August 2017 and July 2021 noted that the first priority to prevent further deaths was to make a safer supply of non-toxic drugs available to people at risk of death due to dependence on the illegal drug supply. This recommendation recognized the serious risk of death to tens of thousands of people across BC and sought the rapid expansion of a safer drug supply throughout the province, including rural and remote and Indigenous communities. The report included a recommendation to create a provincial framework that included both medical and non-medical models for distribution. In November 2022, the province's all-party Select Standing Committee on Health, after receiving briefings from federal and provincial government ministries and agencies, health authorities, and other experts, and hearing from 118 presenters and receiving 881 written submissions, made 37 recommendations. These included a recommendation to ensure safer supply availability in all areas of the province and to consider whether alternative models should be trialed or implemented to scale up the response. In November 2023, the Coroner Service third Death Review Panel into the toxic drug crisis, in recognition of the more than 13,000 lives lost to toxic drugs since 2016 and the continued deaths of 6 or 7 people each and every day, recommended a thoughtful and coordinated model to distribute regulated substances on a non-prescription basis to those at risk of serious harms and death. Safer supply, while available in small, federally funded pilot projects and in some urban centres in BC, is extremely limited and hard to access. Currently, there are about 5,000 people accessing the province's prescribed safer supply program. The only other alternative, the illicit market, continues to be highly toxic and demonstrably unsafe. As per estimates by our expert colleagues, about 225,000 British Columbians are currently accessing this supply. More people than ever are dying. Nearly 7 people every day in 2023. Each day, coroners across BC go into communities and retrieve the bodies of the dead. We have the means to save many of these lives. The more than 2,500 families who lost a loved one this year didn't know they'd be amongst the statistics. How many more families will join these statistics next year? Prescribed safer supply is simply not able to address the scale of the public health emergency in which we find ourselves. Current treatment services are simply not able to address the scale of the public health emergency in which we find ourselves. 1 million people in our province don't have access to a family doctor, never mind the focused and specialized expertise needed to address a public health emergency of this magnitude. Unless we are willing to act thoughtfully, carefully, and with courage to provide a safer supply for the tens of thousands of people at risk in our province, we will continue to count the dead. More people will suffer and more families will grieve. Thoughts and expressions of concern are not enough. Courageous and meaningful action is required. We simply can't continue to watch as thousands of our loved ones die. We can't become complacent with drug toxicity as the leading cause of death for a significant portion of our population. Our Death Review Panel members, like the members of the Select Standing Committee on Health, are not recommending expansion of safer supply versus treatment and recovery. Evidence-based, accessible treatment services are a critical component of a meaningful response to the harms many are suffering as a result of substance use. As noted in the 2023 Death Review Panel report, many officials, committees, organizations, independent officers, agencies, and expert panels, including the BC Coroner Service Death Review Panels of 2017 and 2021 and the 2022 All-Party Provincial Standing Committee on Health, have called upon government, both provincially and federally, to urgently address the drug toxicity crisis by taking comprehensive measures, including reducing stigma, expanding harm reduction, services and prevention efforts, delivering evidence-based, accessible treatment and recovery services, and addressing access to a legal, regulated drug supply. All of these are necessary. Let's save lives. This is my last public event as Chief Coroner, and it has been an incredible honor to have served in this post for the past 13 years. I extend my heartfelt thanks and gratitude to all of those brave and compassionate people across the province, including the coroners, emergency responders, frontline service providers, healthcare professionals, and volunteers who work together to try to keep the people of our province safe. Keep up the good work, friends.
You've been listening to Lisa Lapointe, BC's chief coroner, speaking from Victoria. Now, she's announced BC recorded 2,511 suspected unregulated drug deaths in 2023. That's the most in a single year. Fentanyl continues to be the main driver. You heard her talk there about safer supply and addressing the debate over public drug use. This was her last public event as chief coroner. We'll bring you more on this this afternoon, all through the day here on CBC. The group Moms Stop the Harm has just issued a statement saying that BC should be playing a leadership role on resolving the toxic drug crisis, but BC is once again leading the country's overdose death rate. And in an hour from now, BC's Minister of Mental Health and Addictions will speak to reporters. This is BC Today on CBC. Well, more on this now. Kathy Armstrong is a peer counselor with Families for Addiction Recovery Canada. While her son is now sober, she says the trauma of addiction is wide-ranging, and it affects not just addicts, but their families as well.
What people don't realize is that the numbers, the statistics are all individuals and they're all families. Over 7,000 deaths in the last 3 years. That's all families and loved ones and supporters that are grieving. And then I'm not even in that statistic because my son made it through, thankfully. But the coping that is required to try to keep up with your job and your responsibilities at home, your community responsibilities when you're in this is overwhelming. It's totally overwhelming. It's the hardest thing you'll ever do in your life.
Kathy Armstrong is a peer counselor with Families for Addiction Recovery Canada. It is now 12:29, 1:29 in the Mountain Time Zone. You're with BC Today here on CBC. I'm Michelle Eliot. Very nice to be with you this afternoon. And coming up in our next half hour, we'll take your calls on your struggles to keep up with the costs of living and the rising costs that you're dealing with. Have you had to take a second job? We'll ask you about that and have that conversation coming up in our next half hour. Right now, it is time for a CBC News update, and here's Belle Puri.
Good afternoon. The BC Coroner Service says 2,511 people lost their lives to drugs last year, 5% more than in 2022. It's the highest number of overdose deaths ever recorded in a calendar year. The coroner's report says there's an average 7 drug overdose deaths per day. Vince Reddy has been appointed by the provincial government to mediate the dispute between Coast Mountain Bus Company and its transit supervisors. It's Reddy's second round with the two parties before a 48-hour strike that ended this morning. He failed to reach a resolution. This time he'll have more time to work with the company and its union. Supervisors want a 25% hike over 3 years. Coast Mountain has offered 13%. One man is dead after what police are calling a targeted shooting in Burnaby. The incident happened in the 5500 block of Kingsway. Investigators are looking for witnesses or dashcam video of the area around 10:30 last night. RCMP say the scene has been secured and there's no risk to the public. A look at the BC weather along the north coast. A rainy afternoon, a high of 7 degrees. In the Peace region, a mix of sun and cloud, a high of -5. For the central interior, cloudy with some flurries, a high of -1. In the southeast, the showers will turn to rain as the afternoon moves along. And for the southern interior, showers and a high of 3. And along the south coast, Greater Victoria, periods of rain. They will end late this afternoon. Metro Vancouver, it's going to be rainy right through the afternoon, a high of 8 degrees. That's the CBC News from Vancouver.
Belle, thank you very much. That is Belle Puri in the CBC Vancouver newsroom. We'll continue to follow the latest report from the BC Coroner Service and the Chief Coroner announcing just in the last half hour the number of deaths from unregulated drug use in 2023. 2,511 people died, the most in a single calendar year. 70% were between the ages of 30 and 59, and 77% of people who died were male. We are tracking reaction to that, of course, and coming up in an hour from now, BC's Minister of Mental Health and Addictions, Jennifer Whiteside, will be speaking to reporters with her reaction to the latest numbers. And as you heard from Lisa Lapointe, it was her last public address as the Chief Coroner in BC, as she is retiring next month. And she had a message for the public and the BC government and policymakers when it came to addressing the toxic drug crisis, the public health emergency crisis that continues in BC. We have an email from Hal who writes us about what he heard in the last half hour. And he agrees with the Chief Coroner. Hal writes, those who are preventing the rollout of a safe supply of drugs have to consider their role in the number of drug deaths and injuries due to the current toxic drug crisis. Maybe others have already considered their role. Hal, thank you very much for your email. bctoday@cbc.ca is where you can send us your thoughts on this or anything else you hear on the program. In other news now, the Bank of Canada announced today that its key interest rate would stay at 5%. Bank of Canada Governor Tiff Macklem said this morning that there is continued concern about inflation. And this comes after more than a year of rising rates and, of course, people struggling with both inflation and those rising interest rates when it comes to borrowing money. Now, some Canadians are turning to second jobs to pay the bills. Our CBC colleagues in Newfoundland put together a series called The Grind, and they told the stories of people who have to work multiple jobs. We're gonna hear from some of them, and we're asking you this half hour, have you had to take on a second, even a third job to pay the bills? What's been the impact on you and your lifestyle and your personal well-being? You can give us a call, 1-800-825-5950, 604-669-3733, and you can also hit pound 690 on your cell phone. And by email, it's again, bctoday@cbc.ca. We're going to hear from a sociologist in a few minutes as well. But first, to tell us about the series, Sarah Antle joins me, a reporter for CBC based in St. John's. Hi, Sarah.
Hi, how are you?
I am well. Thank you so much for joining us and telling us more about this.
Yeah, of course. Thanks for having me.
Well, tell us about your series, The Grind, and why you wanted to work on it.
I think that it's very telling that it didn't take a lot to get people involved in this series. And just like the rest of us, it's, the price of everything, the rising cost of living is at the top of everyone's mind right now. So we're always hearing about the rising cost of living, the cost of groceries, the increase in rent, the increase in gas.
Yeah.
So it's very clearly a problem that affects the majority of people. But when you're talking about those prices, we don't necessarily always correlate that to how people themselves are affected by those high prices.
Mm-hmm.
And our executive producer, Peter Gullidge, here in St. John's, came across a pretty grim statistic in a StatsCan report that says that about 1 million Canadians have to work multiple jobs to pay their bills. And the staggering part of that for us was that the number hasn't necessarily changed in the last couple of years, but the reasons that people have to work multiple jobs have changed.
Right.
So now it's about 1 in 3 Canadians have to work multiple jobs just to pay the bills. So
It's
it's
just
no
to keep
longer,
up. Yeah.
yeah, it's no longer for luxury or just for saving money. So, a couple of us relate to that. And we were talking in the newsroom here in St. John's just about how we can tell those stories really from a people first perspective rather than just looking at those numbers, because it's easy to read those numbers and forget the people behind the statistics, right?
Sure.
So,
Well, you said a
yeah.
couple of you relate to it, including yourself.
I do. I work multiple jobs myself, and that practice for me is not necessarily new. I've worked multiple jobs for almost a decade now. So that actual practice is something I'm used to, the workload, but the reasons that I've done that have changed. And it used to be just to save up a little bit of extra money, to have a little bit of extra cash, like most of the people that we spoke to for this series, and it's kind of become a necessity.
Yeah. Can you tell us about some of the people you spoke to?
Yeah, of course. We spoke to 7 people for this series, specifically to do interviews with them, and one of those people actually was a new grandmother. She's always worked in office admin jobs. Her name's Kelly Young, and she recently had to start taking a second job to moonlight as a server on the evenings and weekends, in addition to the full-time 9 to 5 desk job that she works. And she's doing that specifically to maintain the middle class life that she's always been used to. So she tells us a story when we were interviewing her about going to Disneyland with 6 teenagers, and that was something that back, many moons ago, you didn't really have to think about that much if you had a 2-income family, and now they can't even really think about getting on a plane. So she's one of the people that we spoke to, and she's definitely feeling the struggle of having to work multiple jobs and not really getting the family time that she needs.
Let's take a listen.
Tell me about the moment that you realized, looking at the income situation, the expense situation, when did you realize I need to look for another job?
When things started getting tight, and I moved around jobs a couple times since I moved home from Alberta, trying to find a specific wage. I did find 2 particular jobs before this one, same thing, office administrators positions, but the rate of pay was a lot lower for the same job. And, when you get paid, you look at your paycheck after everything is coming out, and knowing that you can't pay all of your bills out of one paycheck. So you're waiting then after that payday for the next paycheck just to top up and pay those bills, and going to bed at night. And all you think about is your income and how you're going to pay the bills. So I think that's when I realized I need to find a second position just to kind of top up my income, to pay those bills comfortably so I can go to sleep at night and just be able to relax. You're always kind of falling behind to the point where you're robbing Peter to pay Paul for paychecks and to get caught up in those bills.
Wow. So I can go to sleep at night and relax.
Yeah.
You can really hear the emotional exhaustion there, Sarah. And what about physically? What did you hear about the impact it's having on people's just sense of physical exhaustion?
Yeah, that's something that both of those things I think go hand in hand, and it's something that nobody that we spoke to only mentioned mental health or only mentioned physical health. They go completely hand in hand with each other, and it's the thing that we actually heard the most about, the effect that working so much has on your mental and physical health. And if you're not sleeping, you can't focus. If you're not eating properly, you're not as productive. If you have to switch tasks so often, you can't really be fully engaged with the task. And it's more exhausting to have to switch between things all the time. And Rafid Khan was one of a perfect example of that. He is a full-time student at Memorial University of Newfoundland in St. John's. He also works a full-time job at a not-for-profit and a part-time job at a car rental company.
Wow. That's 3 jobs.
He almost couldn't. Yeah, basically, yeah. And he almost couldn't even put into words how much this workload affects him. And I will say there was, when we asked these questions about how this affects people's mental health and what they see coming, if they see this ending, if they see if they see any sort of reprieve in sight, a lot of people, there were some tears. There were some tears when we talked about this, and the mental health, and Rafid Khan was that perfect example.
Let's listen to Rafid.
It seems fun, or at least relaxing, when someone says, oh, then I went home and rested. But often rest is just lie down and think, how are you gonna get ready after 4 or 5 or max 6 hours of sleep for another 18 or 19 hours of non-stop on the go.
What does that do to your mental health?
I don't have enough words. I'll be very honest. But it is pretty challenging because at times you can just hear your body scream for more rest. It's just not functioning anymore, but you just can't do it. You just have to study and get the work done, because you gotta make sure you have good grades and also be able to take care of your expenses.
Wow, Sarah. I mean,
I know.
To imagine him, right? Just feeling like your body is screaming for some rest and having to think about the next few hours. Thank you for bringing us those voices. I'll keep you on the line. Thanks for joining us. And we're asking you as well, in light of this series by colleagues, asking you, are you having to work a second job to keep up with your costs? And what is the impact on you? We've heard about mental health and physical health going together there. 1-800-825-5950, 604-669-3733, pound 690 on your cell phone. In a moment, we'll be joined by Professor of Sociology at UBC. Right now, let's take a call from Doug at Salmon Arm. And Doug, do you work a second job?
I do. How are you doing today?
I am doing just fine. What's going through your mind listening to these stories?
So it's funny that, not funny as in ha-ha, but just funny, ironic that you're having this series, because I've been thinking for the last 6 months, for the last 2 years, we've moved from like the baby boomer generation to the Gen Xers to whatever, to the jigsaw generation. And the reason why I say that is because, like, for example, we'll use Vancouver as an example. To get a mortgage in Vancouver is like $2 million. And, there's some businesses that will say, okay, you have 10 hours. This is considered full time. Well, you can't pay a mortgage on 10 hours a week. So you go out and you find a new job, and that might be 15 to 20 hours, right? So now you can't pay a mortgage on 25 hours a week, so you go and find another job. So it's just like a jigsaw, right?
You're trying to fit pieces together to make a whole.
Totally, right? And so that's why I've made this observation that we've gone from, these labeled generations to this visible, seeable sort of marking.
Yeah. And can you tell me, about your own work and what your day is like?
So I own a delivery business here in Salmon Arm, and I also work for the school district. And unfortunately, I can't find anyone to work for me during the day. So I've had to put my school district work kind of on the back burner. But part of the reason why I kept my business that I have is because I'm an EA, and I'm only allowed to work 25 to 27 hours a week. And that's literally written into the contract, right? And I understood that going into that. But I can't necessarily live on 25 or 27 hours a week. So I had to maintain my other job.
How do you feel?
Well, for me, I work Monday to Thursday, 9 a.m. to 9 p.m. Friday, I work 9 a.m. to 10 p.m. Saturday, I work 11 a.m. to 10 p.m. And Sunday, I work 11 a.m. to 9 p.m. So I have very, very little downtime. And I'm exactly the fellow who you played the tape of. I get very tired. Unfortunately, my fuse, which is normally pretty good, sometimes it gets very short. And, it's a grind some days. But I like what I do. And so I like seeing the people I see. I like interacting with the people I see. And, when I get an opportunity to go and work in the schools, I'm using my brain in a different way. And that's healthy too, right?
Yeah.
I mean, I'm fortunate that I have a dog, and at the end of the day, he makes me take him for a walk. and And so he's my downtime, right? And it's kind of a way to disengage and just sort of, we go out and we play in the snowbanks because we have a bunch of snow right now.
Yeah.
We get to be goofy, right? And so I look forward to the end of the day when I actually get to go get some fresh air, and I get to go, and if I see people out walking, I like chatting with them, not work related, but hey, how's your day going? What's new or whatever. And so
You're working.
so-
Go ahead.
and I'm working as we speak, right? So
You-
I listen to you guys in the car as I drive every day. I enjoy the program, but this one I really felt compelled to call because I wanted to share sort of my observation.
Yeah, you're living it, and you observe that it does feel like a jigsaw puzzle, trying to put pieces together. Doug, thank you so much. I know you're working a long day today. I really appreciate hearing from you. Thank you.
Thank you.
You take care.
You too. Bye-bye.
Bye-bye. Doug at Salmon Arm. Let's bring in Sylvia Fuller, who's a professor of sociology at UBC and specializes in work and income inequality. Professor Fuller, good afternoon.
Good afternoon.
What's your reaction to what you're hearing?
Oh, I mean, it's heartbreaking, really. And I think that the stories really highlight the human cost of, the numbers that we see in these Statistics Canada reports, right? So trying to manage getting by with inadequate income, with inadequate hours, is really a struggle for people. And it leads to all kinds of negative consequences. So when you have folks who are dealing with economic insecurity and they're putting in, more hours than is healthy for them, than is, healthy for their families, because we always have to think as well that, it's not just the worker who's affected, it's also their family members, their kids, if they have kids. It's really a challenging situation for people to manage. And it has, not all multiple job holding can be terrible. Sometimes people do it because they want to develop new skills or because it's a passion project on the side. There's some diversity there. But when people are doing it because they can't get enough hours on their main job, and we know that multiple job holding is actually more common for people who are sort of having that jigsaw, as your caller said, to put together, right, enough work across jobs. That's more common for people. But, if they're trying to manage that insecurity, or if they're working a full-time job and then they're having extra hours on top of that, of course, that's really difficult for people, and it has lots of problematic consequences, both for the worker, for their families, and, the communities more broadly that we're part of, where people don't have the time to be engaged. They don't have the time, not necessarily just to see their families, but also to see their friends, to be, involved in community activities. And so we're all the poorer for that.
And before I go to Nathaniel in Vancouver, policy-wise, as we see more and more of these, stories behind the numbers, what could be done?
Well, I mean, it's a complex problem, right? Because you've got a number of drivers that are going on. Certainly the housing crisis with incredibly high housing costs that we had, really strongly here in the greater Vancouver area, but is really spread across the country now, is a huge driver of it. More recently, the big increase in food costs for people are really pushing a lot of people who previously were getting by, but maybe not with a lot of a buffer, to be kind of pushed over the edge. So that's the cost side, right? And I'm not an expert in housing policy per se, so I don't want to weigh in too much on that. But certainly thinking about that side of it, it really does highlight the fact that this is a crisis and that this is something that we do absolutely need to deal with because people aren't able to get by. But then there's also the employment side, right? And that's where you have to look at things like, are we offering a living wage in light of these increased costs? And we've actually seen some sort of backtracking there, like with the city of Vancouver moving away from its commitment to having a living wage for its employees. And of course, this is, I think, a really bad precedent, because to some extent, where you do have, municipalities and other government entities kind of, having that commitment to a living wage, it sort of sets the standard and a norm that can be really helpful, not just for those workers, but more broadly. So, what is our minimum wage? Is it adequate? are we really promoting a living wage where we have the possibility of promoting that, where we have policy levers for that? What are we doing to ensure that the work that is available is, more predictable so that people can count on, they know what their schedule is like and how many hours they're going to get? There's a lot of folks who are sort of picking up extra work in part because they don't necessarily know from week to week how many hours or how many shifts that they're going to get. Can we provide more predictability with scheduling? This is something that, jurisdictions like Seattle are doing. So there's no silver bullet. There's no one thing. But I think that there's a lot of things we can do to tackle that on both sides.
You talk about not knowing your schedule. Nathaniel is on the line from Vancouver, and this is something that you come up against, Nathaniel.
Yeah, I only get my schedule Thursday night for this Sunday, and it's like I'm full-time, but I don't always know if I'm going to get those hours or not because I'm at the bottom of the seniority. So it's like I need a second job, but I can't get a second job because I have no idea what my schedule is. So to get the second job, I need to replace my full-time job. Wow. But it's like I get paid $28, $20 an hour, so it's like a decent wage, but it's not enough. And like I was homeless all summer because I couldn't find somewhere to live on that wage. And it blows my mind that I can't find somewhere to live on $28 an hour. And
you were
I got
homeless.
into subsidized housing, luckily, so I'm able to make ends meet now. But it's like, how do we expect people to get off the streets and people who make minimum wage? How do you expect those people to live when I can hardly survive?
Nathaniel, so you were homeless over the summer months. Can you tell us about what led to that? Obviously, housing costs, but what led to that?
I was living downtown. I was sharing a one-bedroom with somebody, and I was living in the living room with a curtain. That lease ended, and I was not happy with the situation either. And so I couldn't find a place to live in that month leading up to that. I met with people, emailed people, and it's like I talked to one person. They said they got like 500 messages in like an hour of posting a room for rent, and it's like people can be so choosy with who they want to rent to. And so it's like if they like something better than you, you're up the list. Or if you don't respond first, you can't get it.
So what was that like for you then? Obviously housing insecure and then ended up having to live on the streets?
Yeah, it was like thankfully I have a solid friend group in Vancouver. Like I slept in my car a bit. I have a car, so it was a great help, but I slept at friends' couches a lot. There was just so much insecurity with like, I'm done work and I can go home, but it's like I don't have a home. I'm just staying at random people's houses or in my car. Wow. It was the most depressed I've ever been in my life. It was not a good summer, and I thankfully have benefits through work, so I was able to see my psychologist a lot. But like if I didn't have that support group, if I just moved here, I don't know where I would be right now. I understand why people end up doing drugs in the downtown east side or anywhere in Vancouver, because what else are you supposed to do? And like, thankfully I have a support group and I have a counselor that is able to avoid all that. But it's like, I understand that because you get to a point where it's like, you have no hope. What are you supposed to do? Yeah.
And you've been able to find housing now?
Yeah. So I got in subsidized housing. Thankfully, and that's $1,300 a month. It's like I live in basically the corner of Hastings and Maine, and it's like I live in a rough part of town. But even living there now and like walking home and seeing the people on the streets and all of this, it's just like I look at these people with a different understanding of like I, to a degree, get it. Yeah. I'm not saying I completely understand. I wasn't in that situation, but it's like I was almost in that situation. No, and it's devastating.
Yeah, I understand what you're saying. And here you are, you would, we're talking about the impact of having a second job. You would like one, but you can't even apply for one because of the, as we were talking about with Sylvia Fuller, the uncertainty around your schedule.
Yeah, it's like you have no idea when you're working.
But you need it.
Yeah, so it's like, and like with the subsidized housing, I can make ends meet now. But if anything comes up, I can't do it. Like if my car breaks or I need to go to the dentist and get something done that my benefits don't cover, like I don't have money for that. I don't have an emergency fund. I'm slowly going farther and farther into debt. Not like crazy, but it's like it's every month just like a little bit more, a little bit more. I'm like, I can survive, but it's just pushing me into debt. And it's like people talk about saving for retirement in this day and age. It's like that's a joke. You can't.
Nathaniel, my heart really goes out to you. You've been through a lot over these past few months. I hope there's some stability coming for you, and you're able to work through that second job that you do need. Thank you so much for calling in and sharing.
Thanks.
That's Nathaniel in Vancouver. I hope you take care after this call, okay? I have about a minute and a half left. Let me just get some reaction. That really crystallizes things, the way housing, and he even touched on addiction, that when he sees people struggling, he can see what might be behind that. Sylvia Fuller, what goes through your mind? I just have about a minute left.
Well, I think it's just how close to the line so many people are, right? When you have that kind of economic insecurity, whether it's because your level of pay isn't enough or it's uncertain as to how much you're going to earn in a given week, and you don't earn enough to have a buffer of savings. It doesn't take much for things to go wrong, and that's really compounded, of course, by our really challenging housing situation, where if you're a new renter looking for new housing, you're gonna pay even more, right? So that can really trap. Not only can it lead you into quite a desperate situation, but it can trap you in bad situations, right? Like people can be in bad housing situations that they can't afford to leave, or domestic relationships that they can't afford to leave because they don't have that security. So it really does speak to sort of the interconnection between all of those challenges.
It brings me back to that jigsaw puzzle. Thank you so much. Thanks to my guest, Sylvia Fuller, professor at UBC, and Sarah Antle, CBC journalist in Newfoundland.
Thank you.
Thank you.
That is it for our show today. And we didn't get to all of our callers. There were a lot on the line. Really appreciate your calls. And I think we'll continue to follow this story for you because there is certainly a way that it resonates with our audience. You can always email us to bctoday@cbc.ca. I'm Michelle Eliot. Thanks so much for joining us here on BC Today. I hope you have a great afternoon. Take care. We'll talk to you tomorrow.